Before our briefing, we want to recognize our fantastic health officer and chief of public health services, who is sadly leaving us, Dr. Travis Gayles. We'll begin with a short video to show how Dr. Gayles handled the challenges that he faced over the last 18 months and what he'll miss the most about working as the chief health officer for Montgomery County.
How did you handle the criticism, though? There were folks out there who were very critical of some of the decisions that you made. How did you handle it?
Well, again, at the end of the day, our job is to keep folks safe. And we recognize that for some people, the decisions we made did impact them. We recognize that they impacted their businesses and impacted their families. And for others, they took this on as a political rallying cry, which, I can't speak to the motives behind that. And unfortunately, part of the politicization of the public health response is that the public health world has kind of been put in the situation of it's us against businesses, it's us against education, it's us against all these other things, when that couldn't be further from the truth. And so I think the most important thing is that whether we're talking about appointed officials, elected officials, or community leaders, is that we have to have a great discussion about how we balance those priorities. As a pediatrician, I liken it to when you walk into the room with a sick child and their family, and you've got a couple of opportunities. You've got to, one, make sure that the patient trusts you and they're not afraid of you. You've also got to convince the parents that you have the child's best interest at heart and you know what you're doing, and be able to create an environment where they feel comfortable that they are being listened to and they are being heard. Because at the end of the day, you've got to be able to have these conversations to ultimately keep the child safe. And similar to that, take that into communicating with the public. There are a lot of unknowns. There's a lot of uncertainties. And the task is to, one, help make people feel that they can trust you. Not that you always have the right answers, because information is changing all of the time, but that you're being upfront, you're being transparent, and sharing the information and when it becomes available to you.
Last question. When you look back 10 years from now at your time here in Montgomery County, what will be the thing that stands out most to you, and how will you reflect on your time here?
There have been a lot of tremendous great people to work with and to serve, and that has been a tremendous honor. And I am appreciative of, particularly in a pandemic setting, folks being open to welcoming us basically into their homes and to have those conversations and provide that guidance and to listen to what we've had to say. It's interesting when I have gone to other places and seen places that aren't quite as compliant with public health guidance in terms of, acknowledging physical distancing and wearing face coverings. And when you compare it to what we see here in Montgomery County, and we also, vaccination rates, we're leading the country or at the top in terms of vaccine rates. And I see people still, adhering to the guidance and doing what we've asked them to do without a lot of resistance. And that is driving us to where we are, more so than anything I could have said or done or our team could have done. I think the second thing is I have been tremendously blessed to work with a phenomenal staff who have taken on the burden of being quick and nimble and working long hours throughout the last year and a half to get us to a place where we are. So the combination of working with great majority of residents who have put health first and a staff who have been greatly committed to the work that they do has been, at least to this point, the greatest honor of my career.
Okay, that was terrific. I know all my colleagues probably have something to say, Dr. Gayles, but I'll just begin by saying how grateful I am for your service. You've led us through remarkably challenging times when, and you started certainly giving us great advice long before COVID, when your term with us began. But you led us through incredibly challenging times when there was no blueprint or roadmap to follow. You maintained your independence and your allegiance to science and public health principles in the face of an enormous amount of unfair criticism, both from Annapolis at times and from many of our residents. And we're also grateful for your guidance and your leadership through this crisis and your insistence on following data and science. I know that approach is the central reason we have one of the best responses in the nation. You've been instrumental in leading us through that crisis and helping us respond in real time. And ultimately, that's led to saving many, many lives and preventing many debilitating cases of COVID. Particularly as the Board of Health, even once our authority, the county executive's authority changed, you continue to provide the Board of Health with the most up-to-date information and recommendations, which helped us determine the best course of action for the county's COVID response and our regulations. So we're all grateful to you for your commitment to ensuring the health and safety of all of our residents, and we greatly appreciate your tireless efforts week in, week out, days, nights, and weekends, and we wish you all the best in the next phase of your career. Let me turn it over to Council Vice President Albornoz to say a few words, and then other council members. Council Vice President.
Well, thank you, Mr. President. So as chair of the HHS committee, I had the opportunity to meet Dr. Gayles early on in my term on this council. And we crossed over just for a few weeks when I was with the former county executive's office. And I was immediately struck when I met Dr. Gayles with both his innovation and his ability to be able to connect communities. And he also has just a very calm demeanor about him that goes well with serving as a pediatrician when trying to calm down children and their families. And what he has been able to establish through our public health office is extraordinary in the collaboration and connection among so many of our community-based organizations and health clinics and hospitals. And he and all of us were tested in ways, and his team, that were unimaginable. But he certainly rose to the occasion and led us through one of the darkest times in the history of our country and of our community. And he did it with grace. He did it with a tremendous sense of purpose. And he did it by working tirelessly, and I mean tirelessly, around the clock, 7 days a week for months on at a time. So Dr. Gayles, thank you so much for that steadfast leadership and dedication. You will be remembered here for so much, especially your leadership through the pandemic. But I, for one, won't forget all of the other incredible accomplishments that you were able to achieve as our public health officer. So good luck to you, sir. I'm excited about where you're going next, too, because I think there may be an opportunity for further collaboration, especially around telehealth and accessing our youth to better services and programs. But good luck to you. Their gain is our loss, and my best to you. Thanks so much, Dr. Gayles.
Thanks so much, Councilmember Glass.
Thank you very much, Mr. President. And Dr. Gayles, thank you. You did the job that you were asked to do, and that is to keep our community healthy and safe. And the result is that Montgomery County has one of the highest vaccination rates in the entire country. So thank you for your steady leadership and your work ethic to make our community safe. And it was not easy. We all know it wasn't easy, and you particularly know it wasn't easy. And what made the hard decisions even harder is the fact that some people decided to take their hate and bigotry out on you, being a Black gay man. That is unconscionable, and quite frankly, a stain on our community. But you persevered, and you did so with your head held high. And again, the proof of your hard work and our collaborative effort is that here in Montgomery County, we have one of the highest vaccination rates in the entire country. And so thank you for speaking your truth. Thank you for speaking science, and thank you for speaking out. And the work does continue. As a member of the Health and Human Services Committee, before COVID, I remember seeing a number of your heat maps in Montgomery County showing the inequities that exist in healthcare and in so many aspects of our lives. And those heat maps replicated themselves with regard to the COVID hotspots and the COVID vaccination testing. And so while you might not be here as a county official, the work does continue. And as has been mentioned, look forward to possible collaborations with you in your new role. But again, thank you for everything you've done, and thank you for who you are.
Thank you. Councilmember Novato.
Thank you so much, Mr. President. I, of course, want to associate myself with all the wonderful things that have been said so far about Dr. Gayles. But I want to personally thank you, Dr. Gayles, for your extraordinary hard work. your unwavering commitment to assisting the residents of Montgomery County. We're truly fortunate to have you as part of our team, and your successor has some big shoes to fill. In particular, I want to thank you for your partnership and dedication as we work to realize the vision of Por Nuestra Salud y Bienestar and our BIPOC health initiatives in general. We work together to close those gaps in healthcare access among the most vulnerable and hardest hit communities in the county. Those existing gaps were exacerbated by this pandemic, and under your leadership, the progress that has been made to address these underlying issues has been unparalleled. When we look at the vaccination rate for our Latino community, which was among the hardest hit by the pandemic, has surpassed that of any other community in the county. And it is no surprise that thanks to your leadership, Montgomery County now leads the nation in vaccination rates, with close to 80% of residents being fully vaccinated and having some of the lowest new case rates per capita. While we still have more work to do to combat the Delta variant, we should not downplay our success thus far, successes for which we have you to thank. Now, what has always struck me since the start of the pandemic is the grace with which you have approached your duties, even in the face of unwarranted abuse. Even when some of the most hurtful, vile things were being directed at you, you still kept on assisting our residents and maintained a level of commitment to your work that few others could have managed. I just want you to know that throughout this pandemic, I personally felt a sense of comfort knowing that we had such a steadfast partner just an email away. No matter the circumstances, you were always willing to answer questions, and your team has been extremely helpful in getting my office and our constituents assistance and information in a timely manner. I will have to say that as long as I've been serving on the council, I always looked forward to our Board of Health briefings and thinking about Dr. Tillman in particular, and how important it was for us to understand the various issues, the various disparities that existed on so many, variety of issues affecting us. The work with the Health and Human Services Department and Health and Human Services Committee addressing some of the minority health initiatives, issues, et cetera. It was always about figuring out how to prevent, how to affect these issues. Never in a million years could I have ever imagined that we would be facing something of this magnitude, and that our health officer was going to have to literally pivot from prevention and information to action under very difficult circumstances with very little guidance. You led that charge. You shifted, in my opinion, in a real historic type of way, a moment of great unprecedented challenge for us. And the results are there, as they say, the receipts are there, and we have you to thank. So I wish you all the best, all the blessings in your next adventure. And we will continue to do our work here in Montgomery County to lead the way as well. Thank you so much.
Thank you. Councilmember Rice.
So Dr. Gayles, let me just say, as you've heard from my colleagues, thank you. Thank you on behalf of my mom and dad, who both have pre-existing conditions. Thank you on behalf of my daughters, who I care about tremendously, and their health. Thank you for my wife, who worked throughout the pandemic. It was only closed for a short amount of time, but then was there working with clients face to face. And I say thank you because you kept us safe and you saved lives. And that's not something that is meant to be something that's sensationalized. It's a fact. You saved lives here in Montgomery County, you and your team, and the work you did, and especially in our communities of color that we know we saw across this country. And we've all had family members, friends, acquaintances, people we work with who have died from COVID. And you help to minimize that here in this community. That is not something that should be marginalized, minimalized, and not said from the mountaintops. So thank you. You have dedicated yourself, and Councilmember Navarro is right. When we lost Dr. Tillman, I was like, I don't know if we can find another county health officer who's going to give us the same sort of devotion, the same sort of rolling up their sleeves and getting involved and engaging our community and making sure that people understand how important public health is. And thank you, Dr. Kroll. Thank you, the county executive. Thank you for all the team who came together to find you and to bring you on, because we were blessed. We were blessed to have you at this time when it was really important to have someone strong who would be steadfast in leading with science, in leading with making sure that we protected those who were most vulnerable in our community, and who would not be swayed by criticism or insults, vile things, who knew that his purpose was to keep on that road and to make sure that we continue to keep people safe. So just as I started, I said, thank you, brother. Seriously, because what you did, you will always remember. I will always remember. And I hope this community will always remember, because we all owe you a debt of gratitude for what you've done, the service you've given to this community. God bless you.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. And I too associate myself with everything that my colleagues have already said so very, very well. Dr. Gayles, I'm somebody that tries my best not to repeat what's been said, and I'm going to try my best to do that this time as well. But I have to start off by saying, just as all my colleagues have and all my other colleagues will, if I can predict, to say the terms thank you, because you never have heard them enough. I mean, that's for certain. And to your team as well. Many times, as much as we appreciate them, you being the face of the team is who we talk to, and we understand that you have an extremely good team behind you. And you know, I had the pleasure of being the council president when this situation began. And of course it was no one knew what to exactly do, but it was as comforting as it could be, knowing that you were there with us to try to figure out what we needed to do in their next steps. And you took you did a very difficult job and continue to do it, and never backed down from what you knew, what you believed to be the very best possible advice. And I know that we were not shocked that not everyone always agreed. And it was not just in Montgomery County. There was people that disagreed with you, as has been pointed out, throughout the state in most cases. But in a lot of cases, people did agree with you. Some of them were quieter than the people who didn't agree with you. But many people certainly realized that you saved their life. And that's not something that we should ever take lightly. You always handled the situation with respect and professionalism, when at times that was very difficult to do, but you did it. And you know, we mentioned many times that we were building this plane as we were flying it. And you are a great pilot. Let me just tell you, I sincerely thank you for all that you have done, all that you will do for all of us. And I am just so proud to call you my friend. So thank you very much for all that you've done. Mr. President, I turn it back to you.
Well said, Councilmember Katz. Okay, Councilmember Friedson.
Thank you so much. Appreciate all the comments by colleagues. I share and echo them. I will try not to repeat them as well, although I probably have more of a tendency to do that than Councilmember Katz, but we'll try not to do it here. But thank you, Dr. Gayles, for your leadership. I was thinking back to the early parts of the pandemic, those initial briefings that we had with you, the public briefing to say that you had been preparing, which thank goodness you were before the first cases, which turned out to be prescient because the cases came quicker than any of us had anticipated. And then when those cases did come, and I remember you standing up at the podium at a time of anxiety and uncertainty where no one knew what was happening, before vaccines, before we even really knew what this was and what it meant for our families, for our children, for our community and for the country and the world. You provided a sense of calm, you know, in perhaps only a way a pediatrician can, to families, to children. And that was so valuable and so critical at a time when we could have gone into chaos and your leadership continued throughout. I can't imagine you would have anticipated being the single most important person in a jurisdiction of 1.1 million people when you took this role. And it doesn't even begin to discuss all of the responsibilities that you maintained during the pandemic as the public health officer. HIV testing and other vaccinations and other public health crises that were going on that you and your terrific team had to deal with in the midst of the most challenging public health emergency that any of us have ever experienced in our lifetime. So I just wanted to thank you for your calm that you provided, the competence, the expertise that you provided. It hasn't been an easy time to be in your role. I don't think anybody would have expected public health officers to be political figures, which they never should be. But I appreciate the fact that you rose to the occasion, and I'm just so grateful for your willingness to do this job, to step up in this role, and to help lead us through this challenging time. And the numbers speak for themselves. It hasn't always been easy, hasn't always been pretty. There was no book to read to tell you how to do this, no training really that could have perfectly allowed us to be ready for this. But the fact that the county residents stepped up to your leadership and to your guidance has led us to a better place than almost any other jurisdiction in the country. And for that, we all should be eternally grateful. So thank you.
Thank you. Councilmember Jawando.
Thank you, Mr. President. Dr. Gayles, my friend, thank you for everything you've done for this county. You know, a lot has been said. I agree with all of it. I think about when Councilman Friedman was talking about that press conference we all were at, my hair was a lot shorter and a lot blacker. As we stood up there, your hair stayed pretty much the same. You know, I'll point that out. But you know, but we were there. You know, I know Tom appreciates the balding jokes, but we were there. This has been a long journey, and we're still on it. But absolutely, without a shadow of a doubt, I went to bed at night. I know my colleagues. We woke up in the morning. You know, your email was the first thing we checked, the case counts to see where things were. And we fed confidence that you were going to do what you thought was right, using the best data, science, your team, pulling it together, the latest research that was ever evolving and changing, and you were going to give us your best guidance. And we listened. And I think for that, we will all be eternally grateful, and we have benefited greatly. You know, there's a Dr. Martin Luther King quote, and he's got so many quotes. The time is right to always do what is right. And everyone knows that one. But there's another one that I want to read to you because I thought about you this morning when I saw this quote. Never, never be afraid to do what is right, especially when the well-being of a person is at stake. Society's punishments are small compared to the wounds we inflict on our soul when we look the other way. It would have been very easy for you at many points during this journey to take a more expedient path, or to change your recommendations, or to not speak up or out to us privately or to the public. But you were consistent, you were cool, you were calm, you were collected. And that served us very well. As was said, we are the top in the nation on any given day of vaccinated. We still have work to do, but you've laid a great foundation. Your team has helped us tremendously. And all the other work that we've talked about on health disparities, on when we declared racism public health crisis, on our racial equity work, the things that you were still doing on the epidemiological research and data that you presented to us in person prior to the pandemic about disparities, all that will continue. And you've laid some great markers, and really want to just thank you for that. And wish you all the best. We expect some funding and partnership. I'll speak even more than I hope. I expect it coming from when you go to your next spot. So hopefully we can work with you down the line. But thank you so much. God bless you, and Godspeed on your next journey and your next destination. Thank you, Mr. President.
Thank you, Councilmember. Yes, hair loss provides endless comic material. happy to help. Let me call on the genetically blessed Councilmember Reamer.
Just to level set expectations, I don't know how long this will be with me, but thank you, Dr. Gayles. It's been an honor to serve with you. This has been one of the most trying times. It's been 100 years since we've had a pandemic like this, and all of us have been called to reach higher than we've known and make more difficult decisions. But I think perhaps none more so than you, carrying that burden of being a medical practitioner. And it has not been easy. It's been sad to see this country devolve into a war over what really should be, common sense about public health. A war between vaccine denial and virus denial and just trying to keep people safe. And I think you've been an emblem for not only us here in the county, but people across the country for the care and the wisdom that we seek to bring into public service, into government. And I can't imagine the hours that you put in and the late nights. I know it was bad. I suppose at times I was comforted knowing, as bad as I thought it was to have to make decisions, it was worse for you. Don't take that the wrong way, but sometimes you want to know that there's somebody else out there. And we all looked up to you, and I think you were a leader for all of us. So thank you. Just grateful for your service, and hopefully we won't have a pandemic again, but I'm afraid we could. And I know you'll be available for whatever community, or the whole country. And I imagine it's been a special responsibility being the public health officer for a community that includes all the employees, or many of the employees of NIH and FDA and HHS and the White House. It's a very special role, and you have executed it with aplomb. So thank you, and we look forward to following your future work and knowing that you're out there. Thank you.
Thank you, Council Member. I don't see any other requests. So with that, we have a proclamation for Dr. Gayles. I hope everybody has it. Now that I said that, I don't. I will read the first paragraph and then turn it over to Council Vice President Albornoz and other council members in alphabetical order. So this is a proclamation of the Montgomery County Council. Whereas Dr. Travis A. Gayles has been a valuable asset to Montgomery County, serving as Health Officer and Chief of Public Health Services, providing science-based medical direction to ensure the safety and well-being of our residents in the face of a global pandemic. And
whereas a pediatrician by training, Dr. Gayles served as DC Chief Medical Officer before coming to Montgomery County in 2017, where he served for the last 4 years, including during the past 18 months of the COVID-19 pandemic. And
whereas over the course of the pandemic, Dr. Gayles advocated for stringent measures to slow the spread of COVID-19 and led a rollout that resulted in one of the nation's highest vaccination rates. And
whereas Dr. Gayles always advocated for health equity, and especially during the pandemic by creating an equity framework to prioritize vulnerable communities. And
whereas he leaves behind a county with one of the highest vaccination rates in the country for a jurisdiction its size, with over 73% of the population vaccinated, totally vaccinated, and 95% of seniors vaccinated. And
whereas Dr. Gayles also guided the completion of the first Health in Montgomery County, 2008 to 2016, a surveillance report on population health, a comprehensive view of the community's health status that led to the enhancement and development of innovative health programs to meet the health needs of our residents. And
whereas Dr. Gayles also chaired the Montgomery County Public Health Services COVID-19 Advisory Board, the Maryland State Immunization Committee, and the Metropolitan Washington Council of Governments Health Officer Committee. And
whereas he worked alongside the council and the county executive to provide regular science-based health-related guidance across a host of important issues to the public. And
whereas, although we all miss him tremendously, We wish him all the best in his next role as Chief Health Officer for a San Francisco-based startup that provides telehealth services to K-12 schools.
Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes Dr. Travis A. Gayles for his outstanding leadership and contributions to Montgomery County, presented on this 14th day of September in the year 2021, signed by myself as Council President. Congratulations, Dr. Gayles. Do you have any remarks for us?
Good morning. I know there's lots of important work to be discussed upcoming, so I will keep this brief. I will say that in the span of all of the briefings throughout the pandemic, this is the first one where I felt really uncomfortable because I don't like hearing people talk about me in that context, but I'm certainly appreciative of all of the comments and feedback and the opportunity to work with you all throughout the pandemic. And as many of you mentioned, our working together didn't start last February or March. We've worked together continuously on a lot of different topics, and that work will continue. The second thing is, my father always told me that there's certain things that if you live long enough, you'll have the privilege to experience, and baldness is one of those. And so I look at it as a rite of passage, because that means I'm fortunate to still be here and continue to move forward. And speaking of family, I want to say publicly thank you to my family and my friend network for the support during my time in this position, and particularly in the last year and a half. And that sense of family is not only blood family, but also community networks in terms of supporting each other, my fellow health officers and colleagues, and helping us get through all of this and continue the work. And also an extension of that is just the tremendous staff who is a part of public health services and health and human services and other parts of the county response. While as I'm happen to be sitting here, I am merely a piece of a very large puzzle that has done a lot of tremendous work and has built a lot of great infrastructure that will continue to serve the county well. And moving in as a private citizen now, as a resident of Montgomery County, I have full faith and confidence that that tremendous work will continue, certainly with a very capable Dr. James Bridgers serving as our acting health officer, Dr. Kroll continuing as the director of HHS, and all of the other chiefs within their respective areas, and just the team who is behind the scenes getting the work done. A significant and huge thank you to them, and I know they will continue to do great things. And the last thing I will mention is, there has been some reference to, remarks and things like that have been said over the pandemic. I, again, certainly understand that everyone has been impacted by all of the decisions that are being made, and those are experienced on an individual level, a family level, and we have done the best we can with the information we can to put forth guidance to protect everybody, regardless of where you live, what job you have, and all of those different things. But I will be fine, and I am fine. But what it is, the folks who won't be fine are the people who continue to be impacted by all of those things that we talked about that may predispose them to having worse outcomes. And it's incumbent to continue the work to address issues with housing, issues with food security, issues with access to fair employment, opportunities for paid leave, opportunities for childcare, access to good, meaningful childcare, all of those things and all of those social determinants that we have talked about for years, we know impact an individual's ability to be successful and have a healthy outcome. And I am excited about the work that you all will continue to do and the work that will continue to be done in the county to address those issues. So regardless if we're saying a pandemic or not, those issues will be addressed, and we will hopefully be able to see those gaps in health outcomes closed in the coming years. So thank you for the opportunity to work with you all. Thank you to the residents of Montgomery County, and I look forward to future collaborations or partnerships, however they may manifest. Thank you.
Thank you. Thank you for your tremendous service. We wish you all the best in the future. We hope you stay in close touch with us.
Will do. Thank you so much.
Thank you.